In this tutorial, we will talk about the blood vessels in the axilla, which include the axillary artery and its branches and the axillary vein. Starting with the axillary artery. This artery begins at the lateral border of the first rib as a continuation of the subclavian artery. It ends at the inferior border of teres major, where it continues as the brachial artery. Throughout its course, the artery is closely related to the cords of the brachial plexus and its branches. Pectoralis minor crosses in front of the axillary artery and divides it into three parts. The first part is proximal to pectoralis minor. The second part lies posterior to pectoralis minor, and the third part is distal to the muscle. Generally, 6 branches arise from the axillary artery. One branch, the superior or highest thoracic artery, originates from the first part. 2 branches arise from the second part, and they are the thoracoacromial and the lateral thoracic arteries, whereas 3 branches, the subscapular artery, the posterior circumflex humeral artery, and the anterior circumflex humeral artery, originate from the third part. Now to discuss each branch of the axillary artery in more detail. The superior thoracic artery, also called the highest thoracic artery, originates from the first part of the axillary artery and gives rise to muscular and cutaneous branches. The branch supplies the intercostal muscles in the first and second intercostal spaces and the adjacent muscles. The thoracoacromial artery is a short trunk that arises from the second part of the axillary artery, and it has 4 branches. These branches are the clavicular branch, the acromial branch, the deltoid branch, and the pectoral branch. To help you remember the names and the sequence of these branches, simply remember A, P, C, D. A stands for the acromial branch, P stands for the pectoral branch, C stands for the clavicular branch, and D stands for the deltoid branch. The lateral thoracic artery also originates from the second part of the axillary artery. It runs along the lateral border of pectoralis minor, issuing a muscular branch that supplies pectoralis major, pectoralis minor, and serratus anterior. The lateral thoracic artery also gives rise to the lateral mammary branches that supply the breast. The subscapular artery is the largest branch of the axillary artery. The branch originates from the third part of the artery at the lower border of subscapularis, then descends along the axillary border of the scapula to divide into 2 branches. The first branch is the thoracodorsal artery, which accompanies the thoracodorsal nerve and supplies latimus dorsi and the lateral thoracic wall. The second branch of the subscapular artery is the circumflex scapular artery, which passes posteriorly into the triangular space and is bounded by subscapularis and teres minor above, by teres major below, and by the long head of the triceps brachii laterally. The artery ramifies in the infraspinous fossa and anastomosis with branches of the dorsal scapular artery and suprascapular artery. The other 2 branches that originate from the third part of the axillary artery are the anterior circumflex humeral artery and the posterior circumflex humeral artery. The anterior circumflex humeral artery is small compared to its posterior counterpart. The anterior artery originates from the lateral side of the third part of the axillary artery and then passes to the surgical neck of the humerus, where it anastomoses with the posterior circumflex humeral artery. The anterior circumflex humeral artery supplies branches to the surrounding structures, including the glenohumeral joint and the head of the humerus, whereas the posterior circumflex humeral artery curves around the surgical neck of the humerus and supplies the surrounding muscles and the shoulder joint. The axillary vein is a deep vein of the upper limb, formed by the union of the brachial and basilic veins. It begins at the lower margin of teres major and extends upwards on the axilla, medial and anterior to the axillary artery. The axillary vein traverses the lateral border of the first rib and ends as the subclavian vein. The axillary vein receives tributaries from the brachial and cephalic veins and from the veins that follow the branches of the axillary artery. It drains blood from the skin, muscles, bones of the axilla, the shoulder, the superolateral chest wall, and the arm.